give an idea for our members about what it's like to be at a testifying table, so they have a better idea of what it will look like if they ever come. So, to the bill. Senator Lourey said that it was about a new board. And what I'd like to say is it's about more than a new board. And if you look at page 2.3, you will find where it says that the electronic health record system must be connected to a state-certified health information organization, either directly or through a connection facilitated by a state-certified health data intermediary as defined in section XYZ. And so it's very important to understand that this is a mandate that this information be connected up outside the doctor's office, outside the hospital, outside the clinic. This is a mandate for the system to be connected outside of the clinic. So it's more than just creating a board for health information exchange, but actually creating a mandate. Second, I'd like to say that the health department talked about, or maybe it was Senator Lourey, I'm sorry if I don't recall which one it was, about having public input. But in fact of the matter, most of the public doesn't even know that there are opportunities for input, and probably didn't even know that this is even happening. So a lot of the public input that came in was probably not from the general public, who has no idea that this is happening. So I want to bring up two concerns. One is about consent, and the other is about safety. Consent being that the record locator service law that was put in place in 2007 says that the individual has consent when they're at their doctor's office, and that if the doctor says, can I go to a service that I have to get your information, there is indeed consent there, right? But we don't know exactly how informed that consent is, but there is no consent for the record locator service to gather all their information, so that when you tell your doctor, yeah, go ahead and get that information, you don't know that it could include all the pharmacies that you've gone to, every health plan that you've used, every doctor you've seen, every clinic, anything that might even say that you've been to this psychologist or that proctologist or, whatever. So the fact of the matter is there's no consent about your data actually being available to the health information exchange. The only consent is what happens at the doctor's office, and most patients aren't going to understand that all of this information will be available. And it's not just at the doctor's office. How about all of the workers at the hospital who could have access once you say, yes, go and get my previous records? So we have a real consent problem here with this whole health information exchange, and that individuals have no idea how much they are losing and how widely and broadly their information can be exchanged as a result of a law that was put in place in 2007, and then this requirement of a connection here. So as Senator Lourey said, it's not a mandate. It's not a mandate that the state do this, and even if it were, it would be really important for state legislators to stand up and say, we're responsible for our state. We don't have to take that federal money. We don't have to do this to our people. So that's very important. I think it's really important to understand that not everybody wants to be on the grid. Not everybody wants to be online and have all their information available online. Some of them don't want the comprehensive record, or I can't remember exactly what the terms that you used were, but this idea of having a record that follows them everywhere. Some of them want a fresh opinion and nobody to ever see what anybody else has said about them. And we've had some of those people call up our office who happen to take their records from Dr. A to Dr. B and decide to look in the middle and said, now what do I do? There's no way I want Dr. B to see what Dr. A has written about me. So there are things here that have to do with consent. The second one has to do with safety, and I'm sorry, but I forgot to ask somebody to hand this out. But this just came from, if there's a page here, this just was on the 9th, was that yesterday, where the VA halts access to their electronic health record system. And they say in here, starting March 13th, all VA facilities should use phone, fax, paper, or other alternative methodologies to request medical information. Why? Because they discovered a glitch in their system that was providing incorrect prescription information. They thought they fixed it, but it turns out to be a bigger glitch. They discovered it in November. It's March, and they still haven't solved it. The Joint Commission came out with an alert last year talking about the danger of electronic health records and some of the things that can happen, and that a quarter of the medical errors come from the very fact that they have an electronic medical record system. So there are things to think about here, having to do with, the electronic health record and the interoperable electronic health record are not without privacy concerns and safety concerns. And just to sort of look at it like a new technology, and because it's a new technology, it's a great idea, why wouldn't it be a better idea to encourage people to have a flash drive and take it with them wherever they went? And that's a perfect system for carrying your medical records wherever you want to go. Because the fact of the matter is there are concerns around the public. And the last thing that I'll say, Washington Post, by the way, did a really great article, too, about the dangers. The last thing that I'll say is on line 8.34, it talks about the fact that the systems that are created have to be interoperable with the proposed National Health Information Network. That means that the information on individuals will go out of this state, and it will be connected up and nationally available to anybody who's on the NHIN without the consent, because there's no consent provisions here whatsoever. And so what we really believe is there needs to be a right of affirmative, written, informed consent for every individual before their information is put online and shared online and given to the National Health Information, hooked up in that manner. And I forgot to say the one other thing is with the amendments that we noticed the language on line 1.15 to 1.18 where it says that this oversight board can disclose data classified as protected, non-public, or confidential if the Health Exchange Oversight Board and the Commissioner jointly determine that disclosing the data will protect the health or safety of patients. Well, that's a huge, broad loophole. We can say, health and safety, anyone can come up with some kind of definition for that, and suddenly everything is available, confidential, non-public, it doesn't matter. As long as they've come to agreement amongst themselves and nobody else is even consulted, it's available. So these are our concerns with this record, and I thank you for your time and attention.
Questions for Ms. Brase?
Madam Chair, maybe I could just address a couple of the concerns raised. First, I guess it's privacy and safety. To address the privacy, there's a lot of consumer protection provisions built into this bill. The first is that it ensures that the information follows the patient regardless of where they access care, and it works to prevent these silos so that there is one comprehensive record, and I know that concerns you, but one of the things is there's really no consent issues in here. There's no patient info can flow without an individual patient's consent. We have not addressed these laws. We haven't changed them at all, and that is something that is existing in Minnesota's law right now. There is a very clear opt-out provision that allows patients to not be on this at all, and they will not be on this. And you can change your mind. You can be in the system. You can decide that you want that fresh look from a doctor, and you can say, I'm out of that system now. And actually, MedNet is one of the best providers regarding some of these safety issues, and they have the tools to just whoop, you're gone. You're able to be removed, and that is in Minnesota's law, and that is untouched here. Also, in order to get more public access, I should note that the Health Information Exchange Oversight Board does provide for 2 public members to serve on that board, and hopefully you'd have some of the say in making sure that the public is well represented, and that we do continue to be cautious about making sure that we respect the privacy and the individual decisions of consumers out there. And then to safety, I would just say that I think that in aggregate, the data is pretty clear that safety and quality of care is actually enhanced if we can get the accurate information about an individual in front of the doctor or the healthcare professional trying to offer a service, and that you're much better off with this. But if you as an individual disagree with that, you have the opt-out provision. So that would just be my response to some of those.
The consent provision, just let's be very clear that there is consent at the at the doctor's office or the hospital about that doctor or that hospital getting data from elsewhere, but there is no consent, and Mr. Fraser and I talked about this. There is no consent for him to go and be able to find all these bits of data and have the links to all those bits of data, or to limit the amount of data that's available once the individual says, yes,